I am here again today with Bonnie Specker, epidemiologist, who is going to give us an update on the COVID-19 situation that has been happening in our region, across the state, in the nation, and across the world. And also, she's going to talk a little bit today about, the Delta variant, mortality numbers, and then also give some information from the CDC. So, Bonnie, what do you have for us today?
Thanks, Chelsea. I have quite a bit today, and I wanted to just clarify some things that have been out there just to make sure people understand some of these definitions that are being used. As far as the Delta variant, I had done this slide a while ago that looked at the top counties in South Dakota, the ones that have the most populated cities. And if you look at the percent of the population in that county that's vaccinated, and then the percent that is tested positive, and you assume that there is some immunity among these people, then so you add this up and you subtract it from 100%, that's the percent of the county population that's still susceptible. And it's important to remember that this Delta virus, or variant, because it is so transmissible, we need to get this percent susceptibility down to 10 to 20% to be protected from this virus. And you can see that none of the counties are close to that. These are the most susceptible counties, the ones in the top here. Brookings is third, so we still have quite a large percent of the population that is susceptible to this virus, 43% of the county population. This does include children because they are susceptible, and we're going to talk about that a little bit more later. This assumes a couple things. First, it assumes that people that have tested positive haven't been vaccinated. So these are actually conservative estimates because some of this percent of people are probably here as well. So we're double counting them. But also to kind of balance that on the other side, there could be people that have been positive that haven't been tested. So that would add to it. So it's just a rough ballpark estimate to get an idea of how susceptible the population is. And in South Dakota, we're susceptible to this variant. And then I wanted to go in, talk a little bit about how the different organizations are defining community spread, because that's changed over time, and I think it's important for people to realize that. The CDC originally, and this is Department of Health, used minimal spread. These were defined as the number of new cases per week divided by 100,000 population, and minimal spread was less than 10. So if you take into account the Brookings population size, that would be if Brookings had less than 4 cases a week. Moderate spread was 10 to 100 new cases per 100,000 population per week. For Brookings, that would be between 4 and 33 new cases per week. Substantial spread would be 100 or more new cases per 100,000 population per week, which would come out to 34 or more new cases per week in Brookings County. The Department of Health, because that bounces around, right, from week to week, the Department of Health, that map they have on their dashboard, they use the average over a 2-week period to define that. They use these same numbers, but they're basing it on the average over 2 weeks so that it's not changing so much. Recently, the CDC has added this website here that takes into account not just the number of new cases per week in defining spread or community transmission, but it also takes into account the percent test positivity. And that's because a county could have a small number of cases, but that's because people aren't getting tested. So I just wanted to show people what it was right now for using those definitions. In the weekly slides that I give, I have the current level of community spread and this is just based on that original definition of 1 week of data. And this past week, Brookings has actually moved into substantial spread. Last week we were in moderate spread. If you look at the DOH website, they have us as being in moderate spread. And that's because they're taking the average of last week and this week, which puts us actually right up here around 33 new cases per week. So if we have anything higher than this, which I think was, 20 cases maybe? I'm sorry, yeah, 20 cases per week. Then next week, we will be in substantial spread by the Department of Health definition, because the average of this plus whatever happens next week, if it goes above here, it's going to be substantial, and anything really above 20 is going to put us that average up there. But the issue is that test positivity, and Brookings actually has a high test positivity, so there are a lot more cases out there likely to be than what we're seeing. And this is the CDC. Again, it's this website. You can go in and look at the whole United States. This is county level data. And you can see here that Brookings is orange, which is considered substantial spread. And this, again, is taking into account not just the number of new cases, but the test positivity. And it's very possible, this is only through August 9th. The Department of Health only posts their data once a week. So this graph or this map doesn't include the data that came out yesterday, that big increase in number of cases. So in the near future, will turn to red probably next week. This is only updated once a week. The other thing I wanted to talk about is the children, because this is a susceptible population, and there are a lot of reports out there in the media right now about children and the high number of hospitalizations that they're seeing. So I wanted to look at that data a little bit and talk about what the CDC and the American Academy of Pediatrics are recommending as far as K-12. And I thought this would be a good time with school starting up in the near future. Both the CDC and the American Academy of Pediatrics are recommending that indoor masking of all students, teachers, staff, and visitors to K-12 schools, regardless of vaccination status. And they're doing this for a couple of reasons. First, their goal is to keep the schools open, and they don't want large outbreaks in schools because you're going to be quarantining a lot of children, and if it gets really bad, they're going to have to shut the schools down. So the goal is to keep the schools open and the children healthy. The COVID cases have increased nationally since the middle of June, and that's driven primarily by this Delta variant, which is highly transmissible. We're talking, greater than chickenpox. So it's a lot easier to get this virus, this variant of the SARS virus, than it was last year at this time. So it's highly transmissible. And within schools, you have mixing of both vaccinated and unvaccinated people, not just the students, but also the staff, because it isn't mandated that schools, the staff within schools have to be vaccinated, at least within South Dakota. Children less than 12 are not eligible for vaccination right now. And if you look at the 12 to 17-year-old age group, it's a low percent of the population that's been vaccinated. These are links, both for the CDC and the American Academy of Pediatrics guidelines, and people can go to those and read what they do, and also the members if they want to know the expertise of the people that were involved in coming up with these recommendations. This is an interesting website. This is the COVID tracker, and it's on new hospital admissions data. And here you can go in and you can look at different parts of the country. If you look at South Dakota, it's really all over the place because our numbers are so small. We don't have a very large population size. So I thought I'd just show the United States. It's a lot smoother data because of the large numbers. But this is the number of new admissions per 100,000 population. So they're dividing this by the number of people within these different age groups. And this is the less than 17-year-olds. And you can see that we are now higher as far as the number of admissions than we were at any time during this pandemic. So there is quite a large increase in the number of hospitalizations. This has led some people to think that the Delta virus may be more severe in children than the previous variants, but they're not really sure about that. So there's still a lot being done. There's things coming out almost daily on that. I tried looking at some of the original reports, and it didn't seem like the data were good enough to say, yes, it's more severe in that age group. So I think that's still up in the air. And this may just be that it's being spread so much within this age group that's why we're getting the high numbers. But it's interesting because here, that yellow is down here. So you can see it doesn't look like much here relative to the other age groups, but it is interesting to note that it's still higher than it last year in November, which was, in January, which was the really bad time in the US. But if you look here, these are the older people, the 70 plus, and you can see that there are not as many hospitalizations now as there were back here in January. And if you go down and look at these different ages, it flips so that you get down here. This is the 18 to 29-year-olds. We're at about the same number of hospitalizations now as we were during the peak last year. And then here you look at the next age group, the 30 to 39-year-olds, you see the same thing. But then, as you get older, that switches so that the numbers now for these older age groups are much less than they were during the peak. But the younger people are now the ones getting hospitalized, I guess is what I'm trying to say. Not just the children, but less than 50. The hospitalization rates are higher now than they were last year. Part of that is probably because they're the ones that have the lower vaccination rates. And that's important to remember. Okay, moving to the mortality data. The Department of Health just updated this website. It's the second one listed right here. And they've updated it through May of 2021. The 2021 data are provisional, not the 2020. This should not say provisional. They have finalized that data set now. But you can see in this blue line, which is the number of deaths by month in 2020, and these other lines are different years all the way back to 2010. You can see that in South Dakota back in July of last year, we really started going above what we normally see in terms of deaths per month. And that persisted back here through December. Then when you go to 2021, it's still high in January and February, but now, in March, it really started getting back down into where you see in previous years, although it's still running probably a little bit higher than average. If you look at the difference between observed and the average, we have just looking at 2020, we have 9,857 deaths. On average, for those 10 years, we have 7,602. That difference is 2,255. But if you look at the number of deaths in 2020, according to the death certificate data that DOH has, there were 1,497 deaths. So there's a difference here above what we would see on average. And that difference could be due to misclassification of deaths, that were COVID deaths but not classified as that. It also could be that people delayed health care that they needed and ended up passing away from other reasons. Another possibility is that the health systems were overwhelmed back here in November, and that led to poor care, or it just could be a random fluke. So it could be any one of those, but the deaths, the observed number of deaths was quite a bit larger than what you see on average, even above and beyond what they attributed to COVID. Here, this is looking at causes of death across these different years. For 2020, COVID was the third leading cause of death. You have heart disease as the first, cancer as the second. And then usually you have lower respiratory diseases or unintentional injuries kind of in the past have been flipping as far as what's the third leading cause. But here you can see this large increase in the number of deaths due to COVID in 2020. Now, looking at 2021, the way they do that is they look at just the months that they have. And so this is from January until May. And so this year, back in 2016, these are just the number of deaths from January to May of that year. Okay, so this is just the first several months of the year. And you can see that so far, COVID deaths in 2021 are still the third leading cause of death behind heart disease and cancer. So as far as the weekly summary, I guess it's bi-monthly summary, but if you want to look at it weekly, you can look at the slide packets that are posted on the city website. So as I mentioned, we're in substantial spread for this week. DOH does have us listed as moderate spread, but that's likely to go up next week. There have been 4,316 cases. This past week, we have 46 new cases in Brookings. The week before, we have 20, so more than double the number of cases. You can see that here, all summer we've been doing really well. Last week it went up, and now we're much higher than we were then. And I thought I'd add to this slide the ages of those new cases. There were 7 of them that were younger than 20 years of age. 20 of them were between 20 and 39 years. 5 of them were 40 to 59 years. And there were 14 that are 60 and older. And I think this is an outbreak. This is kind of a fluke. There haven't been that many in that older age group for a while. Okay, so for the state, we've had a total of 126,000 cases. There were 862 cases this past week and 429 the week before. So again, doubling of the number of cases. And this is a little worrisome. I was worried, I think I mentioned back here, but just because it's looking, it's almost like, well, it is an exponential growth in the number of cases. So we are starting into this outbreak, and if you remember, there's about 880 cases, I think, would put us into substantial spread. So the state is very close to being in substantial spread based on that definition that we've talked about of 100 new cases per 100,000 population. So this is not looking good, and you can see it's back where we were in early November or early September, late August of last year. If you look at hospitalizations, these have also doubled. Last week, there were 39 new hospitalizations. This week, there were 75. The number in the ICU has not changed. It was 12 last week and or the week before last, and 13 this past week. I'm sorry, these are the number actually hospitalized. But if you look at actual admissions, those have doubled, 20 for the week ending August 4th and 45 for the week ending yesterday. And that's showing here. So we're starting to get that increase in hospitalizations, which always, usually lags behind by a week or two from the case data. If you look at the age of hospitalizations, and I added this because of that slide showing in the United States a high number of pediatric admissions, there were actually 4 of these hospitalizations that were less than 20 years of age, and 1 between 20 and 39, and 17 between 40 and 59. And then, as you would expect, a large number in the 60 and older. So here are the deaths for South Dakota. These are not following that pattern that we've seen before with the cases going up and the hospitalizations going up. There was something, this increase last week, but this week that just ended, there was only 1 death compared to 7 the week before. This 1 death occurred in someone 50 to 59 years of age. So this you would expect to lag quite a bit behind the number of cases. So these are those 10 counties with the most populated cities. Brookings is this solid yellow. You can see the last 2 weeks ago when I gave this presentation, we were actually doing really good, and Pennington was at the highest here. Brookings has steadily increased quite dramatically over the last 2 weeks. Underneath of Brookings is Minnehaha. We're tracking right on top of it, followed by Pennington, and then Lawrence County. And if you remember that one chart, that table that I gave in the beginning of the presentation, Pennington, Lawrence, and Brookings are the 3 counties that have the highest percent of susceptible people. It's interesting that Minnehaha is up here as well, since they were actually in the bottom of that table with the least susceptible. And I think part of this increased spread can be attributed to people not really worrying about being out and about. And I think that is shown here pretty nicely. I updated the mobility data off of Google this week. So this is for the state. There's also a graph in that packet of slides for Brookings. But you can see people, this is white, is the percent of time that's being spent at home. It's about equal to the baseline, which was back here in February of 2020. This yellow line is the number of visits outside of the home. And you can see that if you compare it to last year, where people are out a lot more this year than they were last year at the same time. And if you remember, this is where we started having the large outbreak in South Dakota. That this was really our worst time. And you can see that actually in the mobility data, where people started spending a lot more time inside and less time outside. Now, if you look at the United States, it's also in the middle of this outbreak. 843,000 new cases last week compared to 695,000 the week before. We've had a total of close to 37 million cases. If you look at the deaths, we had 4,000 last week compared to 3,000 the week before. So these are increasing again. They're They're delayed by a couple weeks compared to the cases. If you look at the world, there have been close to 205 million cases, 4.5 million cases last week compared to 4.2, 4.3 cases the week before. So we're still going up worldwide. And deaths have gone up a little bit as well, though they're hovering really around that 66, 67,000 deaths a week. That's close to 10,000 deaths a day worldwide, which is sad. So I did try to find like a comic or something because I'm really tired of this pandemic. I'm sure everybody out there is. And I couldn't find anything that wasn't political, which is really sad. But I just want people to realize I'm weary of this whole thing, and I'm sure they are. You know, we're all tired of it. But we have to realize that this virus is changing and that this current variant spreads more efficiently than all the previous variances, and that all of the national and international public health agencies are recommending not just vaccinations, but what they call non-pharmacological interventions. And that's going back to what we had before with the masking, the social distancing, and avoiding crowds and poorly ventilated spaces. And that's based on a lot of the new things that they know about this virus. You know, people can be vaccinated, they could be asymptomatic, but they could be shedding the virus and getting other people infected. So that's the main reason they've gone back to a lot of this, and the fact that there's such a high percent of unvaccinated people. So for the good of our community, people really should think about getting vaccinated and to also follow these public health recommendations. You know, vaccination, and we talked about this last week. I've heard from a couple people, well, they know someone who got it that's been vaccinated. I just recommend looking at the video from last week. I think or 2 weeks ago. There's a reason for that. And, it's explained in that video. And yes, you can still get sick if you've been vaccinated, but it is very clear from the data that are out there that you will not get as sick. So, please get vaccinated and also follow these non-pharmacological interventions as well. So hopefully we might do this, I think, in a week, or if 2 weeks, hopefully we'll have better news then, but it's not looking very good at the moment.
Yes, absolutely. We will keep you updated. So look for either a video next week or in 2 weeks. We have been doing 2 weeks, but we're just going to keep watching the numbers and make a decision next week on whether or not we're going to give you an update or not. But I just also wanted to let people know, if you are considering getting vaccinated and you just don't really know where to go get that done, or if you have any questions about that, we do have a link on the city website that I put in the description of this video, where you can go find out where you can get vaccinated in Brookings. Or even if you have questions about it, you can call your healthcare provider and just ask some questions to be informed. Also, make sure you continue to follow those National Health Agency and State Health Agency recommendations. Always keep up to date with the information on those sites, because they're releasing articles and releasing new information daily as they learn more about the vaccine and as they learn more about this new variant and other variants that, maybe are being found as this, as the virus continues to change. So continue to watch those sites, keep updated on information based on them, and we'll let you know what's going on as soon as we find out as well.